Your body may be sending a critical early alert through your bedroom. Erectile dysfunction is often not just a matter of age or performance, but one of the very first signs of silent, developing heart disease. We will explore how to recognize these red flags before it's too late. This isn't a conversation about virility, it's a conversation about longevity and health. We will calmly and clearly break down the science, separate fact from fiction, and provide you with the knowledge to take control of your health. To understand the profound connection between a man's erections and his heart, we need to think about the body in a very simple way. Imagine your entire circulatory system, all 60,000 miles of arteries, veins, and capillaries, is the plumbing system of a house. For the lights to turn on and the taps to flow, these pipes must be open and clear. The heart is the main pump, responsible for pushing blood through this vast network to every single part of the body. Atherosclerosis, the condition we commonly call hardening of the arteries, is like rust, scale, and grease slowly building up inside those pipes, narrowing the passage day by day, year by year. An erection is a purely hydraulic event. It requires a surge of blood flow into the penis, filling its spongy tissues. For this to happen, the arteries leading to it must be able to open wide and allow a rush of blood to enter. If those arteries are narrowed by this internal buildup of plaque, blood flow is restricted, and achieving or maintaining a firm erection becomes difficult or impossible. Here is the crucial fact, the one that makes this a life-saving topic. The arteries that supply blood to the penis are among the smallest in the body, only about 1 to 2 millimeters in diameter. Compare that to the coronary arteries, the ones that feed the heart muscle itself, which are larger, at 3 to 4 millimeters in diameter. The smaller pipes will always show signs of blockage first. A 50% blockage in a tiny 1 millimeter artery will have a dramatic effect on erectile function. That same 50% blockage in a larger 3 millimeter coronary artery might not produce any noticeable symptoms like chest pain yet. This is why erectile dysfunction is often called the canary in the coal mine for heart disease. It can predate a heart attack or stroke by 3 to 5 years, acting as a precious, early warning that the entire vascular system is in trouble. At the heart of this problem is a condition called endothelial dysfunction. The endothelium is the delicate, single-cell-thick inner lining of all our blood vessels. A healthy endothelium is smooth and produces a gas called nitric oxide, which is the master signal for the blood vessel to relax and widen. When the endothelium is damaged by years of high blood pressure, high cholesterol, smoking, or high blood sugar, it loses its ability to produce enough nitric oxide. The vessels become stiff and can't relax properly. This failure to relax and widen is the direct cause of both erectile dysfunction and the constricted blood flow that leads to a heart attack. The first major warning sign that points toward a vascular cause for erectile dysfunction is the nature of its onset. If the problem is gradual, developing slowly over a period of months or even years, it tells a very specific story. You might first notice that erections are not quite as firm as they used to be. Then, perhaps it becomes more difficult to maintain the erection. Over time, it may become challenging to achieve one at all. This slow, progressive decline is a classic hallmark of atherosclerosis. The buildup of plaque inside your arteries is not an event that happens overnight. It is a slow, simmering process that unfolds over decades. The gradual worsening of erectile function perfectly mirrors this silent, creeping disease within your blood vessels. Contrast this with erectile dysfunction that appears very suddenly. A man who had perfectly normal function on Monday and then a complete inability to have an erection on Tuesday is more likely experiencing an issue related to psychological stress, a new medication, a nerve injury, or a significant life event causing anxiety. While these are also valid medical concerns, they do not typically point to this slow-burning vascular fire. Therefore, paying close attention to the timeline is essential. If you can trace the issue back and see a pattern of slow, steady decline, you should consider that a very strong signal. It's your body telling you that a physical, mechanical process is underway. The plumbing is slowly getting more and more clogged, and it is imperative to find out why and to what extent before the blockage affects more critical pipes in the system. The second warning sign is the presence of other subtle symptoms of poor circulation. Because atherosclerosis is a systemic disease, meaning it affects the entire body's network of arteries, it is unlikely that the blockage is occurring in only one place. While the small arteries of the penis may be the first to produce a noticeable symptom, there are often other quiet whispers of a larger problem. One of the most common is called intermittent claudication. This is a cramping pain or tiredness in the calf muscles that appears when you walk a certain distance and then reliably goes away when you stop and rest for a few minutes. This happens because the leg muscles are demanding more oxygen-rich blood during exercise, but but the narrowed arteries in the legs cannot deliver enough. The pain is the muscle's cry for oxygen. Other signs can be even more subtle. You might experience unusual shortness of breath when doing something that used to be easy, like climbing a flight of stairs or carrying groceries. This could indicate that the heart is having to work harder to pump blood through a resistant network of narrowed vessels. Some people notice that their hands or feet feel colder than they used to, or they may experience numbness or tingling, which can also be a sign of reduced blood flow to the extremities. None of these symptoms on their own is definitive proof of heart disease, but when they appear in conjunction with erectile dysfunction, the picture becomes much clearer and more urgent. It's a collection of clues all pointing to the same underlying culprit, a compromised circulatory system. Ignoring this constellation of symptoms would be like hearing a smoke alarm and seeing smoke under the door, but choosing not to investigate the fire. The third warning sign is perhaps the most powerful from a diagnostic standpoint: erectile dysfunction that occurs in a man who already has one or more of the major risk factors for heart disease. If you are a man dealing with ED and you also have high blood pressure, high cholesterol, diabetes, or a history of smoking, the probability that your erectile issues are a sign of underlying heart trouble is exceptionally high. Each of these conditions is a well-known aggressor against the health of your arteries. Let's break them down. High blood pressure, or hypertension, is like subjecting your pipes to constantly high water pressure. Over time, this force damages the delicate endothelial lining, creating tiny tears and rough spots. These damaged areas are like magnets for cholesterol and other substances to stick to, initiating the formation of plaque. High cholesterol, specifically high levels of LDL or bad cholesterol, provides the raw material for this plaque. It's the gunk that accumulates on the damaged artery walls, slowly narrowing the channel. Diabetes is particularly destructive. Persistently high levels of sugar in the blood are toxic to both the endothelial lining of blood vessels and the nerves that control them. It accelerates the process of atherosclerosis and can also cause nerve damage, which adds another layer to the problem of erectile dysfunction. Finally, smoking is like pouring a corrosive chemical directly into your plumbing system. The hundreds of toxins in cigarette smoke directly poison the endothelium, cause inflammation, and make the blood stickier and more likely to clot. A man who smokes and has erectile dysfunction has one of the strongest possible predictors of a future cardiovascular event. When ED appears against this backdrop, it should be considered a red light, a direct and urgent warning that your risk factors are no longer just numbers on a lab report. They are causing tangible, physical damage. The fourth warning sign is a more private but very telling clue: the consistent absence of nocturnal or morning erections. Healthy men experience several erections during the night, typically during the REM stage of sleep. This is a natural, involuntary process controlled by the brain and the autonomic nervous system. It is often most noticeable upon waking in the morning. These erections are essentially a nightly tune-up for the system, keeping the tissues healthy and oxygenated. They are a powerful indicator that the physical equipment, the nerves, the blood vessels, the erectile tissue, is capable of functioning correctly. Therefore, if a man is consistently not experiencing these morning erections, it strongly suggests that the problem is physical, not psychological. Performance anxiety, relationship stress, or depression can certainly inhibit erections during waking, conscious sexual activity. However, these psychological factors generally do not prevent the involuntary erections that occur during sleep. The persistent absence of these erections is a sign that the underlying hydraulic machinery is failing. It points away from a purely mental cause and strongly toward a physical one, with vascular disease being the most common culprit. It's a simple, at-home observation that can provide a doctor with an incredibly valuable piece of information, helping to distinguish a plumbing problem from a temporary issue of the mind. The fifth and final warning sign is a poor or diminishing response to standard, first-line erectile dysfunction medications. Pills like sildenafil, tadalafil, and others in their class are known as PDE5 inhibitors. To put it simply, they work by amplifying the body's natural signal to create an erection. When a man is aroused, his nerves release nitric oxide, which tells the blood vessels to relax and open wide. These medications help that nitric oxide signal stick around longer, giving the blood vessels a better chance to dilate and allow blood to rush in. However, these medications cannot perform miracles. They can only work with the vascular system that is already there. If the arteries leading to the penis are severely narrowed or hardened by advanced atherosclerosis, there is a fundamental mechanical barrier. Even if the medication is working perfectly to signal the vessels to open, the vessels may be too clogged or too stiff to respond adequately. The channel is simply too narrow to allow the necessary volume of blood to pass through. Therefore, if a man finds that these medications, which were once effective, are no longer working, or if they never worked well in the first place, it can be a sign that the underlying vascular disease is more significant than suspected. It suggests the blockage is not mild, but potentially severe. This is not a failure of the medication. It is a signal about the advanced state of the underlying disease. It is a critical piece of feedback from your body that requires immediate medical attention to assess the health of your entire circulatory system. Recognizing these signs is the first, crucial step. But the second, and most important, is acting on that knowledge. This means having a courageous and honest conversation with your doctor. Many men feel embarrassed to bring this topic up, but it is essential to reframe the conversation in your mind. You are not discussing a performance issue. You are reporting a critical symptom that could save your life. You can start the conversation very directly. Doctor, I have been experiencing erectile dysfunction, and I have read that it can be linked to heart health. I would like to be evaluated for my cardiovascular risk. This straightforward approach immediately tells your doctor that you are serious about your overall health. A good physician will take this concern very seriously. The initial evaluation is typically simple, painless, and can be done right in the office. It will almost certainly start with a thorough measurement of your blood pressure. The doctor will also order a simple set of blood tests. This will include a lipid panel, which measures your total cholesterol, your LDL, bad, cholesterol, your HDL, good, cholesterol, and your triglycerides. They will also order a test for your blood sugar, most likely a hemoglobin A1C test, which provides an average of your blood sugar levels over the past 3 months and is the gold standard for diagnosing diabetes. The doctor will listen to your heart and lungs, calculate your body mass index from your height and weight, and ask detailed questions about your lifestyle, diet, exercise, and family history. Based on these simple, fundamental data points, a doctor can get a very clear picture of your overall cardiovascular risk. If these initial tests raise any red flags, you may be referred for further testing, such as an electrocardiogram, ECG, to check your heart's electrical rhythm, or even a cardiac stress test to see how your heart performs under exertion. This is the path to taking control. Now, before we talk about what to do, it's critically important to clear away some of the dangerous myths and misconceptions that surround this topic. The first and most pervasive myth is the idea that erectile dysfunction is just a normal, unavoidable part of getting older that a man simply has to learn to live with. This belief is not only incorrect, but it is also deeply harmful because it prevents men from seeking the care they need. While it is true that a man in his 70s may not have the same erectile function he did in his 20s, a complete inability to achieve or sustain an erection firm enough for intercourse is not a normal part of aging. It is a medical condition with an underlying cause. The reality is that age itself doesn't cause erectile dysfunction. The health problems that become more common with age are the true culprits. Atherosclerosis, high blood pressure, and diabetes are all more prevalent in older populations, and these are the primary drivers of vascular erectile dysfunction. Modern medicine no longer views this condition as a mere quality of life issue or an inevitable consequence of aging. It is now widely recognized by cardiologists and urologists as a vital health marker, a barometer of a man's overall cardiovascular and systemic health. To accept it as normal is to ignore one of the most important warning signs your body can give you. The good news is that because it is a medical condition, it often has a treatable cause, and addressing that cause can improve not only your erectile function, but your overall health and longevity as well. Another very common myth is the assumption that the primary cause of the problem must be low testosterone. Many men, influenced by widespread advertising, immediately conclude that their issue is low T. They might seek out clinics that promise a quick fix through testosterone replacement therapy without conducting a thorough investigation of their vascular health. While it is true that testosterone plays a key role in a man's libido or sexual desire, it can have some influence on the quality of erections. It is rarely the main culprit behind erectile dysfunction, particularly in men over 50. The scientific and clinical reality is that the vast majority of age-related erectile dysfunction cases are caused by problems with blood flow, the vascular issues we have been discussing, or, in some cases, nerve damage, often related to diabetes. A man can have perfectly normal or even high testosterone levels and still suffer from severe ED if his arteries are clogged. Focusing solely on testosterone as the problem is a critical mistake because it can lead to completely overlooking the far more dangerous and life-threatening issue of underlying heart disease. A responsible doctor will always evaluate a man's vascular health first and foremost, checking blood pressure and cholesterol before even considering testosterone levels. Treating only the testosterone without checking the pipes, is like repainting a house that has a crumbling foundation. It might look better for a short time, but it ignores the real danger. Perhaps the most dangerous myth of all is the belief that herbal supplements or products marketed online as natural Viagra are safe and effective alternatives to prescription medications. The internet is flooded with these products, which often use appealing language like all-natural, ancient secret, or herbal power to lure consumers. The reality is that these supplements are almost entirely unregulated. This lack of oversight means two things, both of which are extremely dangerous. First, you have no way of knowing what is actually in the pill you are taking or in what dosage. Second, and more alarmingly, numerous investigations by the Food and Drug Administration, FDA, have found that a significant portion of these natural supplements are secretly adulterated with the very same active pharmaceutical ingredients found in prescription drugs like Viagra, but in wildly inconsistent and potentially hazardous doses. For a man with undiagnosed heart disease, taking one of these mystery pills can be lethal. Prescription ED medications can cause a significant drop in blood pressure. This is why they must never be taken by men who use nitrate medications like nitroglycerin for chest pain. The combination can cause a catastrophic, fatal drop in blood pressure. When a man takes an unregulated supplement, he has no idea if he is consuming one of these hidden ingredients. If he is also taking heart medication, the risk of a deadly interaction is very real. These products are not safe alternatives. They are a game of Russian roulette. The only safe way to address erectile dysfunction is through a transparent conversation with a qualified medical professional who can prescribe a known medication at a known, safe dose after a proper health evaluation. The good news in all of this is that taking action to protect your health is straightforward, and the steps you take will benefit both your heart and your erections. The best approach is a two-for-one solution. The very same lifestyle changes that are proven to prevent and even reverse heart disease are also the most effective ways to improve vascular erectile dysfunction. This isn't about a magic pill. It's about fundamentally improving the health of your entire body, starting with your blood vessels. The first pillar of this plan is adopting a heart-healthy diet, with the Mediterranean diet being the most researched and recommended model. This means building your meals around fruits, vegetables, whole grains, beans, and nuts. It involves using healthy fats like olive oil instead of butter and choosing fish, especially fatty fish rich in omega-3s like salmon, over red meat. These foods are rich in antioxidants and anti-inflammatory compounds that help heal the endothelial lining of your arteries. The second pillar is regular physical activity. The goal should be at least 150 minutes of moderate-intensity exercise per week. This can be as simple as a brisk 30-minute walk 5 days a week. Exercise does something remarkable. It stimulates your body to produce more nitric oxide, the very molecule that helps your blood vessels relax and widen. It is nature's own treatment for vascular stiffness. If you smoke, quitting is the single most powerful and immediate step you can take for your vascular health. Within months of quitting, your endothelial function begins to improve, and your risk for a heart attack starts to drop. Finally, managing other factors like moderating alcohol intake and finding healthy ways to cope with stress will further reduce the burden on your circulatory system. The main conclusion we can draw is this: erectile dysfunction is not something to be ignored, hidden, or endured in silence out of shame. It should be viewed as a vital messenger, a potentially life-saving signal from your body that deserves your full attention. The 5 warning signs we've discussed: a gradual onset, the presence of other subtle symptoms, existing risk factors, the absence of morning erections, and a poor response to medication, are your cues to take proactive control. Your health is in your hands, and it depends not on following myths or buying questionable online products, but on a timely and open dialogue with a doctor. Remember that many of the changes that come with age are not a final verdict, but a medical problem that has a solution. The connection between erectile health and heart health is no longer a mystery. It is established medical science. By viewing this issue through the lens of overall health, you empower yourself to make changes that can dramatically improve your quality of life and, more importantly, add healthy years to your life. Taking care of yourself based on knowledge, not fear, is the most reliable strategy for a long, healthy, and fulfilling life. Talk to your doctor. It is a simple conversation that could protect not just your vitality, but your very life itself.